Hello, I'm Nadia Al-Samri with Diabetes Health. To my regular subscribers, welcome back. To my new subscribers, thank you for joining me. Today I spoke to Jake Leach, who is the Vice President and Chief Technology Officer at Dexcom. I had some CGM Dexcom users reach out to me and ask me if I could have them answer some questions for them. So here's Jake. Before we get to the interview, don't forget to like, subscribe, and press the icon so you can get alerted when my next video comes out. Thank you for joining me, Jake.
Yeah, it's a pleasure to be here, Nadia. Thank you.
Yeah, so this is a new format for me. I'm part of a Dexcom group on Facebook, and there are about 19,000 users. And I had gone to them and asked them if they had any questions about the Dexcom, and reached out to you. And I'm so thankful that you stepped in and are here to answer questions for people.
Absolutely, yeah. Happy to answer all the questions and give some insight into Dexcom technology.
Great. So the first question comes from Dave. It says, why doesn't Dexcom make a transmitter that has a user replaceable battery?
Yeah, that's a great question. So we've gone through lots of different iterations of designs internally, right? We've had designs where we thought about using rechargeable batteries. We thought about replaceable, and the current reason why we don't do the replaceable is basically the design to ensure reliability with a user replaceable battery is actually quite challenging. One of the things that is the most important design criteria around the electronics, the transmitter, is its ability to measure very, very small sensor signals. And so one of the things that we design around is it's called basically moisture protection or resisting moisture ingress. And so if you think about it, trying to design something where you could put a reusable battery into it in a format that most customers could use, right? Because this has designed for a lot of different types of people with different skill sets. And so we felt that the best way to do it was to build a device that has the battery all encapsulated to protect the electronics in the battery. And then it basically gets replaced every time the battery ultimately dies. With our G7, we've actually integrated everything into one, so there's no need to keep track of separate transmitters or a prescription for a separate transmitter. It's all one piece. So it's a much simplified approach over our previous generations where the sensor was different than the electronics. They're two different pieces.
I see. And so Dave asks, what's the biggest limitation on extending the sensor site from 10 days to something longer?
Yeah, it's a great question. So coming at it from two different approaches. So for us to extend the sensor life to something, let's say like 15 days, we want the vast majority of all users' experience to be that the sensor lasts the entire 15 days. Today, the sensors do perform quite well out to 15 days for many customers, but not enough. And so the technologies that we're working on to extend the life of the sensor for all customers is twofold. One is the adhesive. So there's a really important part, I think many of CGM users would recognize the adhesion of the patch to the skin is so important, right, to keep the CGM in place. And part of that is a balance between the aggressiveness of the adhesive and potential adhesive reactions and allergic reactions and all those things that we balance with medical devices. So that's part of it. And the other part is the sensor probe is going into an environment in the body in vivo, which is one of the things that makes CGM technology challenging, is that you're putting a sensor inside of living being under the skin. So there's a wound response that happens when the sensor's inside the area where the needle drops it off under the skin, and the body reacts to it. And everybody's bodies, have slightly different reactions. And so we find that some sensors don't last the full period, and you get the thing called sensor failure. And that's when we detect that the sensor is no longer accurate and we turn it off. So we have a pretty good algorithm that does that, detects the sensor failure. So we have new materials. It's something we've worked on over time, right? The first Dexcom CGM was a 3-day, and then we went to 7 days, and then we went to 10. And so we have several technology projects to bring it out to 15 days. And one of the big parts of doing that is the materials on the sensor probe and how the body reacts to them. And so we've got some great technology that we've been doing clinical studies with for extending sensor life out. So more to come. We definitely are extending the life of the G7 platform out to more than 10 and a half days. But for the initial period of that product, it'll be 10 and a half.
Right. It seems that over the years, it's been extended, like you said, from 3 to 7 to 10. So we can only expect a continuous evolution of that, I imagine. Lynn asks, how soon can the G7 be out? Will Medicare patients get the G7, or do they have to wait for a while like they did with the G6? So we know that Medicare does cover people with type 1 diabetes, right? So I'm not sure if we're assuming this person's a type 1, but maybe you could comment on both for type 1 and type 2.
Yeah, so Medicare covers CGM for anybody on mealtime insulin. So if you're taking multiple daily injections of insulin or on an insulin pump, CGM is covered, G6 is covered in Medicare.
So you could be a type 2 taking insulin and it's covered.
Yeah, and it's covered. So the other aspect of that question was when is G7 available? So currently it's CE marked and we're launching it in Europe. It's available. It's live right now, actually in the United Kingdom, and more countries to come soon. In the United States, G7 is under review by the FDA. So that we submitted to the FDA at the end of last year, and so we're going through that back and forth process that we're very accustomed to when getting a new product approved, where there's a question and answers back and forth between us and the agency. The review's going really well, and so we're still in the process of going through it, though. But as soon as the product's approved, we're going to get it out to customers as fast as we can. One of the things we learned with our G6 launch was that we under anticipated the demand. So when we launched G6, the demand far outpaced what we were originally predicting. And so two things that we learned was, one, we need to be able to scale our manufacturing operations faster than we were with G6. So the lead time to say, hey, we need to build more inventory and more products and more manufacturing lines, we need to be able to do that faster. So that actually is something we did with G7, is those lines are much faster to stand up. And we also have significantly more capacity with G7 ready as soon as we do get the approval to build the product for all customers. So there won't be, G7 or G6 we launched over a number of years in different segments around the world. G7 we intend to do quite a bit faster than our G6 rollout was. And then one thing about the way that it works with Medicare and other payers is that when the product gets approved by the FDA, that's when we can initiate our discussions. Medicare is actually one of the faster ones for approval, so that takes up to sometimes 90 days for that review to happen after the approval. So we anticipate getting G7 out to customers very quickly after approval.
And Jake, when it is approved, is for the U.S. market, is it manufactured here? Do you manufacture them in the different countries for Canada or the U.S. or? So just in terms of, you brought up the demand and supply. So is that part of the solution, is manufacturing where it's closer to the regions where there's a higher demand?
That's a kind of a future approach of ours. Today, we have manufacturing facilities in San Diego, California, as well as in Mesa, Arizona. So that's where the bulk of all the product, that's where all our product is manufactured today. We're in the process of standing up new manufacturing facilities internationally. To that, your point around being a little closer to all the different patients we serve. So as we build out capacity, it won't only be in the United States, it will be abroad. But today, our manufacturing is in the United States, split between those two sites.
And so for the markets that you serve abroad, say then you ship from the United States to the different countries currently.
Yeah, we ship in bulk to distributors or to our offices around the world for distribution.
Okay, so Tom asks about getting a sensor error, and then on day 4 to 8, it says replace sensor now. What does that mean?
Yeah, so I'll take a couple parts of that question. So the sensor error is when we are detecting that the sensor signal is not reliable, but based on the signatures, which we have, almost basically 2 decades of experience looking at these sensor signals and developing algorithms around them, we predict that it's going to resolve itself. So it's basically an aberrant sensor signal that we think is going to resolve itself. So we put sensor error to the user and don't display the values because they're not reliable to make decisions off of. Often the sensor signal returns, and then that was just kind of like a periodic time period. When it says replace sensor now or sensor failure, that means one of two things. Either the total 10 days on G6 has elapsed, and so it'll say replace sensor now because you've used it for 10 days, and that's the allotted period. Or it's that we've detected that the sensor signal is not accurate and it's unlikely to resolve itself. And so that's when you get either the sensor failure signal or the replace now. And that can happen before the full 10 days. That was like to my earlier point around it can happen, and it does happen. It's a fail-safe built into the system, but we don't want that to happen very often to users. And so as we design the systems to extend the life of the sensor, that's one of the things we're focused on, is minimizing the sensor errors or sensor failures that customers get.
So is this also an illustration of what you just stated earlier, which is sometimes that the body rejects it and you could get a sensor error, or is that different?
No, it's the sensor error often, it's something physiologic, right? It's not something with the actual sensor. If you put the sensor in a peak of glucose, it would work just fine. So it is often, it's related to the physiology in the sensor wound site, and they're usually pretty short in duration. But then sensor failure is when, for example, the wound response has occurred and you're towards the end of the days on the sensor and it's no longer reading accurately. And so that's when we turn it off. That was a big part of the special controls that we worked with the FDA and established the criteria for performance of a integrated CGM. It was around performance of the sensors, and when they're not accurate, we turn them off so that customers don't make decisions off of them, or that closed loop systems don't use that input. So that's basically the way the system is designed.
So we have another question from another Tom, a different person. It says, I've been using the G6 for a few years now, and lately I consistently get a signal loss error message. I've called Dexcom and the support replaces the transmitter. This occurs once a month. I need a new transmitter, which is, he says, Dexcom's been really great about replacing. So what do you want to, what happens when you get a signal loss? What's happening technologically?
Sure, yeah. So signal loss is when the wearable, so the CGM that's on the body, is not communicating to the display device. So for example, the mobile phone. So it loses Bluetooth connection, and so it says signal loss. And sometimes it can be the transmitter, as kind of Tom suggested there, and he's getting replacements. There's one of the things I always recommend to users who experience that is within the app, you can actually go to support or on our website. And there's a lot of FAQs around signal loss, because it is a little more complex than often initially it seems, because when you think about a mobile phone and all the different Bluetooth connectivity options that are there, connecting to your car, headsets, all kinds of devices.
Your lights in the home, the stereo.
Yeah, everything, right? It's all that's the great thing about Bluetooth, is why we utilize it, because it's so ubiquitous across so many display devices. But there are some challenges with it, and one of the things that we found is that FAQ has a long list of things that can be tried. And what we find is that often new users sometimes have more signal loss than users that have been using the product for a while, because they haven't tried all those tricks. The other thing, though, too, is I've seen sometimes just the mobile phone configurations, like maybe you've loaded something new on your phone that is, demanding more of the Bluetooth bandwidth than you'd had before. So it's one of those things to go back and look at. Often resetting or reinstalling the applications can help resolve it. But that's my initial response always to anyone who has that issue, is to check out that FAQ.
And to piggyback on that question, does it matter which phone or technology you have, which smartphone? Does the Dexcom work better with certain devices, less consistent with other devices? What would you say?
Yeah, well, it can be, there can be kind of Bluetooth differences between mobile phones. And so one of the things we do is for compatibility testing. Everyone always asks me about phone compatibility. And one of the things we do is every single model, and every single time there's an update to the operating system of the phone, whether it's iOS or Android, we validate that the Bluetooth is still a reliable connection. And there are some phones that aren't reliable, and so we cannot put them on our compatibility list because the users would not have a good experience with them. And so that's what we're trying to get ahead of there. So in general, the mobile phones, Android, Samsung, iOS, all those devices, they work great. insulin pumps and the display devices, generally get about 20 feet of range, but for the display device to the wearable. Now that can be variable, if you're maybe laying on top of the device, sometimes it reduces the transmission range just because 2.4 gigahertz, which is what Bluetooth operates on, it gets absorbed by tissue and other things. But in general, it's good performance. And that's why we validate the phones so that users don't have a lot of variability there.
So can people, again, to piggyback on that, can people have a phone that requires an update and their phone is old and it won't update? So then I would imagine, because Dexcom is usually syncing to the most current updates, then that wouldn't work for the person. Would that be a scenario where it wouldn't work for somebody?
I'll basically paint the picture of what happens is, phones get older and we do updates. So what happens is we support back many years of devices. So we go back several generations of iPhones and across the Android ecosystem as well. So we try to make sure that we support not just the latest phones, but even, multiple years back, and also the operating systems. What can happen, though, is as we have to continually update our mobile applications to be compatible with the most recent iOSs or operating systems on the phones.
Right.
Sometimes when we make those updates, that new app is no longer capable of running on, say, an older phone. But what we do in those instances is just the user can't upgrade to the latest G6 app, but they can continue using the G6 app they have. We don't shut that off. So they can still, they still have their legacy app that'll still work for them just the way it did, before we came out with the new one. It's just they can't upgrade to the new one because their hardware is too old. A lot of that's kind of basically dictated by the companies developing the operating systems, whether it's Android or Apple with their iOS. They implement all kinds of new features that require the new hardware. So.
And can people go online to Dexcom's website where you show all the phones that are compatible and all the ones that stop being compatible, and at least with what generation? So people are, they're budgeting or they're planning, they don't want to get a new phone, or, people that use a Dexcom love it, of course. So it's part of their planning if something's going to phase out or is not compatible anymore. I know you said they could use the old technology, but I just wanted to know, is there a list for people to go and check which phones work the best, that are the most efficient with the current technology?
There is if you go to our website, there's a compatibility page that you can select what generation of the product you're on, G6 or G7, and you can see what phones are compatible with it, and also with our Clarity app, because we have a Clarity app, our G6 app, G7. One of the things is that just because it's not on that compatibility list doesn't mean that you can't use it. For example, when iPhone, like a brand new iPhone comes out, you can still use that phone. It's not on our compatibility list yet because we're testing it. But we have confidence over the many years that often we don't find an issue, and so we kind of run it from there. But it's definitely a important aspect of the compatibility is to check. But the latest iPhones usually takes us a number of weeks to get all the testing done to say yes, we guarantee it's compatible. So we do is if a user is in that situation, we actually issue a notice at the time when they start the app that just says, hey, we're still working on testing this.
That's nice.
And then once the compatibility is there, that message goes away.
Okay. Our next question is from Victoria. She says, sensor error, do not remove, wait 3 hours. What does this mean? Does it typically resolve itself, or do I need to resolve my sensor and replace it? Remove my sensor and replace it, excuse me.
Yeah, that's similar to that sensor error. It's the same kind of vein as that earlier question around based on our read of the signal from the sensor is that it will resolve itself. And that's why we say it can take up to 3 hours to resolve. Many times it's a lot faster than that. So just let the system continue to operate. And then what'll happen is if it doesn't resolve, then we will issue a sensor failure. But based on our predictions, it's going to come back. So that's why we issue the sensor error.
Okay. And then when they get a sensor error or sensor failure, they can reach out to support and they'll replace the sensors that failed?
Yeah, sensor failure, you can reach out to tech support. There's multiple ways to do it. There's even within the mobile app, you can go and click on support and open a ticket for a replacement sensor. And you mention what your issue was. and that's a nice way to kind of expedite the process.
Yeah, that's great.
And so, yeah, that's all kind of built into the G6 and the G7 app.
All right. So Donna asks, can Dexcom make the receiver with the clip to hang from pants, pockets, or neckband? I don't always have pockets, pants, or belt loops, nor do I carry my phone around 24/7.
Yeah, that's a great question. So, in designing the receivers, we're always trying to kind of meet the most common use case, and the most common use case is that people like to have it in their pocket and they like a small device that's convenient. But the clip does come up, right? And so one of the things that we've seen is there's a great community out there that's developed a whole lot of accessories for the products, pouches, bands, all kinds of things that can be found out there that are ways to support, the device and allow you to wear it the way you want, whether it's a, lanyard with a pouch or, a case that has a clip on it. There's a lot of options out there.
All right. Well, we could put a link to resources for that question. Kathy asked, when will we be able to administer boluses from the app on our phone?
So for that one, that's actually that question is kind of best targeted towards the insulin pump companies, because the G7 app doesn't connect directly with insulin pumps. G7 and G6, the CGM does, but when it comes to actually bolusing of insulin from pumps, that would come from the manufacturer, either Tandem or Insulet's mobile applications, which I know they do have that technology. So
right, I know Tandem does.
Yeah. Exactly.
Yeah, they're real good. Okay, Arthur asks, what green technology? Why doesn't Dexcom make batteries so we can put new batteries in them rather than trash the device? So this is more of it's. So I guess it's more of recycling. So it would be easier to make batteries so that we can put new batteries in. So I don't really understand that question really well. So the battery for the sensor is what they're referring, or are they referring to the battery for the handheld device? We don't know.
Yeah, not exactly sure, but I can tell you. So the handheld device is rechargeable. So that one, you just keep recharging it. It's probably talking about the wearable component, the transmitter. And so it's kind of similar to that earlier conversation question we had, which was around replaceable batteries in the transmitter. And so we feel
that's the duration, right? That ties into the duration going from 3 to 7 to 10 to 15. Okay.
Duration and also size. As we look to make the wearable as small as possible, the more interfaces you have on it, the larger the device gets. And so one of the ways to make it as small as possible is to have a very small battery that's consumed while you wear it, and then the device is replaced with, and a new battery comes in. I think one of the great things about G7 is pretty significant reduction in both the packaging waste. So the 67% reduction in packaging. Just the box is a lot smaller, both for the display device, the receiver, and the transmitter. And then the device itself is 60% smaller. So it sounds
like Dexcom has already moved in that direction with
we
miniaturizing the transmitters.
Yeah, miniaturizing the transmitters, as well as the sustainability of our footprint, the environmental footprint of our devices. We make a disposable device. It's there's a needle involved, sensors that go under the skin. So those are not the types of things you could reuse, but it is an important part of our design criteria is to make the environmental footprint as small as possible.
So Livia, this is an international question. It says, why not make the app available worldwide and not insert country limitations for downloading? This person is from Romania, but also people from Moldova use it. So they were just wondering, I don't really know about the international component of it, but when people download, like when we're in the US, we just go to the App Store, right? We download it.
Yeah. So one of the unique things here is this gets into regulatory approvals. So
I see.
We can only host the app in stores of countries where the product is approved. For example, we have a product called Dexcom One that we just launched last year in a number of countries in Eastern Europe: Bulgaria, Estonia, Lithuania, Latvia. And so those were the first time we brought Dexcom into those geographies. And so now that the product was approved there, the apps are available. So it's really dictated by approvals for the regulatory body that governs that country.
I see. That's interesting. Jason asks, can Dexcom update their phone app compatibility faster?
Yeah, it's a great question from Jason. Yes, absolutely. It's one of the things that we continually worked on, both doing it faster and then also expanding the number of phones we support. There's quite a bit of effort that goes into the compatibility of each device to ensure it's reliable. But it is an area that we are seeking to really enhance, because we know customers, when they need to upgrade their phone, they need to have compatibility with the system. So it is something we're focused on improving, and it has improved over time. Our cycle times have decreased, but they're still not as low as I want them. I want this to be a very quick process, and so part of that is just scaling out the teams that actually do that work and making sure that we can do it as efficiently as possible.
And Jake, there's got to be like hundreds of phones. I can't imagine. Just as you were speaking, I realized of all the people around the world, all the different generations they have, all the different technology. How do you guys handle that? That's a very large body of data to integrate. Yeah,
it is. Actually, if you go to that compatibility page and actually see how many versions of operating systems and phone models we support, it's quite a few. It's not every device though, as you mentioned. There's thousands of devices out there. So we kind of, based on customer feedback, focus on the ones that are the most popular, and also that we know are going to work well with the system with Bluetooth reliability. But it is complicated. It's something over time that we've developed, right? Initially we were just on the iPhone, and then we moved to Android, and then we've expanded the ecosystem of devices, but we still have more work there to do to make it even more compatible around the different handsets.
Okay, so that's our last question. My question to you, is there anything that you can share with us that's on the horizon that people can get excited about, or anything that's going on with Dexcom that people can look forward to?
Yeah, there's tremendous amount. I think the up and coming thing that's really exciting is our G7 product. So that's the next evolution of Dexcom CGM.
And Jake, how's that different from the G6, just so people that don't know?
Yeah, that's a good question. So it basically is, we took all the things that our customers love about G6 and enhanced them and made them better with G7. And I'll give you quite a few examples. So to start off, the applicator is quite a bit smaller and simpler than the G6. And it's actually as simple to deploy the product, as simple as you take the cap off. And this one is a demo, so it doesn't actually have a sensor, so I can just deploy it in my hand.
You can't see the needle,
yeah. So you just press the button, and it deploys,
that's nice.
It deploys the sensor and the wearable.
Nice.
And it's very, very thin, and really, 60% smaller than G6, so quite a bit smaller. And it's all in one. There's no need to snap a transmitter in to the device. So it size and kind of that less steps to apply the sensor are some of the first things that customers will notice. One of the other things is that the mobile app for G7 that goes on the Android or iOS phone, it's a completely redesigned application. So we started introducing mobile compatibility with G4, and then G5 and G6. We continued to build upon the same software. With G7, we said, okay, things have advanced enough in software. It's time to come up with new architecture and something that we can scale more rapidly around the globe. That was one of with G6, one of the things that limited our ability to release it across different countries. The time frame was just how long it took to update all the software with the different languages and everything, the different regions. So G7 is designed to be able to do that very rapidly. It's a new, more modern software architecture. But from a user experience perspective, there's a wonderful onboarding where when a user signs up, they enter they get their account, and then it walks them through exactly how to use the product with some really nice illustrations. So that makes it really simple if you're just getting started for the first time on CGM, or if you're a G6 user and upgrading to G7, it tells you all the things you need to know. From a sensor technology perspective, one of the things I'm most excited about is the startup time. So historically, CGMs have a period of time where once you apply the sensor, there's a warm-up period. And so for Dexcom CGM, since our first product, the 3-day, it's always been 2 hours. Others have been longer. But for Dexcom, it's always been 2 hours. With G7, we actually reduced it down to 30 minutes. So once you apply the sensor, it produces reliable, accurate data within 30 minutes, which is a big leap forward in CGM technology, like the fundamentals. So very excited about that. Some of the other things to note would be we added a feature called grace period. So I mentioned earlier 10.5 days for G7. So what we did was we realized based on a lot of customer feedback that the time to replace sensors, it's not always the most convenient when it's exactly 10 days after you inserted it. So you insert your sensor in the morning, 10 days later, that same time in the morning might not be the most convenient time. So people have to shorten their sensor period or go without data. So what we did was you get your full 10 days, and then we have an extra 12 hours of what we call grace period, where you can find a time that's more convenient to replace the sensor. And during that time, the sensor's accurate, reliable. We studied the performance with G7, largest clinical study we've ever done to assess the performance of a CGM. And we actually studied it out that extra 12 hours just to make sure that it was accurate and reliable. So, things like automated insulin delivery systems and all the decision making that the data is used for is just as accurate in those last 12 hours as it is during the use of the product. So that's a nice kind of user convenience. And I could go on and on. There's also quite a few things we enhanced about the alerts, the glucose alerts, to make them more convenient, more accessible, more discretion, and a little bit less fatigue. That all based on significant user feedback from our previous generations. So very excited about all of those things. Last thing I'd add is that with G7, our intention is to, with this new software architecture, is to come out with more updates, more frequently. So previous our cadence, it's kind of once a year, every potentially 18 months, we do an update to the app that brings in some new features. We want to do that much more quickly with G7. We have a whole, it's called the backlog, but it's all the things we want to work on to get into the products. You have the initial launch version, and then we have multiple versions that we're going to come out with of the software that enhances functionality. And so very excited about that as well.
Well, I think people that are Dexcom users that want to upgrade are going to be really excited about all these things that you mentioned. That there's the sensor is smaller, onboarding is quicker, there's a grace period, the start time, and the backlog. So those are really great things.
Yeah, it also has a brand new receiver. So we've gotten some great feedback about it. It's smaller than the G6 version, and a nice vibrant display, and and extra long battery life on that receiver. So that if for those that want to use a separate display device and not use their phone, or if they want to use it at the same time as their phone, they're still able to do that like they are with G6. And so another upgrade of the system.
Sounds great. Well, thank you so much for joining me, Jake. I really appreciate it. And I know the people that have asked these questions, they've emailed me and said, hey, the minute you do the interview, please post it and let us all know. So I know they really, really appreciate it. Thank you for joining me.
Yeah, of course. It was a pleasure, and glad I could help shed some light on those questions.
All right. Thank you.